Ritesh. It's indeed a pleasure for me to be having a chat with you on such a lot of change and innovations that are happening in this space of healthcare. So, as we all know, 2020 was really a watershed year like no one else has witnessed in our entire history or our memory. I think the pandemic taught us a lot of lessons, both on a personal level as well as on a professional level. And since we're at the beginning of the year, I want to start the discussion with thinking a little bit about some reflections and learnings that we are carrying on from 2020 to 2021. And Ritesh, as you steer the ship for Optum for India, what are some of the lessons that you're going to take forward for your team, for your organization, and for the healthcare system at large?
Well, Dr. Das, I think when we have exhausted all the standard cliches for 2020, new normal or paradigm shift or whatever we say, what we will be left with is, I think, a sense of amazement at what all of us have been through, and a deep sense of gratitude for everyone that came through together. Whether it's the scientists that worked literally at warp speed on the vaccines, to the healthcare workers that worked at great personal risks and stress, to all of our employees and their families, to who adjusted so quickly to the new circumstances, all the way down to, I guess, the food delivery walas, who allowed us to work so effectively from home. So it's actually been, as you said, a truly amazing year. And as a quick introduction, I think Optum is the largest healthcare service company in the US, serving about 125 million individual consumers, 9 out of 10 US hospitals, 9 out of 10 Fortune 100 employers. Our mission, if you will, is to help people lead healthier lives, and to help the healthcare system work better for everyone. And to do that, we basically leverage advanced technology and try to solve some of the toughest challenges in healthcare. We have about 25,000 people in India, and we cover the entire gamut of technology services, which we can talk about later. But in some ways, as a healthcare innovation company, this is really the moment that we were built for. As an example, we had almost through the pandemic 100,000 clinical team members who were working on the front lines of the crisis across 1,500 of our facilities. We were operating about 400 COVID-19 testing sites. In fact, our CEO, Dr. Andrew Whitty, was asked to lead the WHO effort to roll out the vaccine, and he actually left us for 6 months. He went to run that effort for WHO, and he's back again. In India, for instance, Optum contributed close to 9.5 crores to the PM and various CM relief funds. But I think from a business perspective, which you asked for, I think there are 3 key things I want to point out. One is agility can be learned. Many of us in India went from being nearly 100% work from office to nearly 100% work from home just in a matter of days. It took a lot of agility and coordination to get there. Our families adjusted to how they are living their lives, and I think the interesting output, at least for Optum, has been in India. We've observed a material improvement in our productivity, through all of this, and that's quite amazing. So it can be learned. And all of this, as you know very well, and I'm sure we're going to discuss this soon, is this has helped accelerate the role of technology in healthcare. What would have otherwise accomplished in months or years, we've done that in a matter of days and weeks. And then finally, I think a people first philosophy. When what we realize is, as a company, that when we are aligned, when we have a common peril or a common enemy in front of us, we can come together in unique ways and achieve wonderful things. And I hope that we can learn from this and keep our people first posture in everything we do going forward.
That's really a fantastic contribution for your firm as well as for yourself and through these turbulent waters. And you're completely right. I think agility is one of the most important things to be able to pivot and change course that many organizations are unable to do. And what is really interesting is that, as we move forward, I think the challenge will be, how do you keep up with that agility? How do you keep up with that quick change? in your systems, in enabling decision making effectively and communication effectively all through the organization virtually. And I think today those are some of the things that we are working on as well in our organization. So as we move into 2021, I think obviously there is all companies have big aims in healthcare to bring about change. One of the big things I'm working on today is the whole concept of innovating at zero. Bill Gates talked about this whole concept of innovation at zero and changing the whole concept of what that really means. And I think it brings to light very, very truly how relevant it is to healthcare. For example, looking at a world where there is zero disease, for example, zero infection, zero medical waste, zero invasive surgeries, zero side effects. I mean, in healthcare, it's the applications are just tremendous. So when I look at working at such a large, lofty, utopian world, which is what one of my goals are in this business, how do we break it down? And I think today for India, it's based on just three basic things: reducing cost, making healthcare accessible, and providing quality of care. So, what role is your organization taking in doing some of this so that it will lead us on a journey in the future, who knows when in the future, 10, 20, 30 years, where we get to this innovation mindset at zero?
It's fascinating to hear you talk about the march to zero, and I actually think both you and your firm is doing some good work on what we're calling the quadruple aim, and I think that's something we should. I hope we get time to talk about. So let me try and give you a shorter response and see if we can create a dialogue around it. But fundamentally, I agree with you. Healthcare is expensive. And more than that, healthcare costs have been growing, for example, in the US, much faster than the rate of inflation, which is a big worry because as people age and as people retire, they worry whether they can afford quality care anymore. In a country like India, I'm sure you're aware of, and I'm aware of many examples where a simple medical diagnosis actually leads to bankruptcy in a whole family, and that's the situation. When we say it's expensive, it's really expensive. And in some ways, actually, and I'm sure you'll agree, this is actually a result of our own success. What I mean by that is, as we live longer lives, than our parents and grandparents did, we tend to live it with some chronic diseases and such as heart diseases, diabetes, renal conditions, etc. But we do lead normal longer lives, and for example, in the US, close to I would think about 80% of the healthcare cost actually goes to about 20% of the people of the population. So in addition, I think the other cost driver is we've recently started finding solutions to previously intractable problems. To your point around march to zero disease, and as you start curing or finding solutions for certain things, they come at a cost. Either expensive diseases or devices or expensive procedures or even the medicine sometimes very expensive. But earlier they were just not available. Now they're available for a price, but then your cost goes up. And finally, I don't think we can leave the conversation on cost without talking about fee for service as a cost driver. If the model is that we simply charge you every time you walk into a clinic, and we charge you for every X-ray, and we charge you for every procedure, then chances are that the incentive to bring down cost is not there. So how do we move from a fee for service to a value based model is also a critical point in the cost conversation. So, what can be done, and I can only talk about what we are doing towards it in a couple of examples. But one is, as at Optum Care, for example, which is our care provider, we are moving seriously to a value based model away from a fee based model. So we are currently, I think, serving over about 20 million members on a value based model. Um, the second is around site of service, and you know this better than anyone, but site of service is a key driver of cost. Where you serve them, if I'm serving them in a hospital already, your costs are way up. So using advances like telemedicine, telehealth, AR, VR, we are actually able to move the site of service into your house in some cases, and and that can help bring down over a period of time the cost significantly. For example, our Vivify Health business is creating devices and IoT-based devices, etc., that can seamlessly provide and monitoring of certain population in the comfortable setting of their homes, and that brings down costs. So that was the second point. And then third, obviously is better predictive models. If you can predict gaps in healthcare, then you can actually solve for them before they become bigger problems. So how do we use modern AI and tools and techniques to identify gaps and go after them early enough is important. For example, we are developing a infectious disease prediction model that we think if we can scale it, then we can predict outbreaks before they happen and help solve them. And finally, I would say you know, a razor sharp focus on administrative costs. And this is where technologies like RPA and AI are helping replace, if you will, labor with capital. And so we can build non-linear platforms that we can put, instead of putting more bodies, we can just scale the platform using technology for our operations. So these are some standard techniques that I think we are using to bring down costs. But I'm keen to hear if you think that there are some other things, or so there, if you have more nuance to add, I would love to hear it.
No, definitely. I think you bring up very good points. I mean, we've been battling the whole value-based care model in the United States since Obamacare. So it's been more than 4 or 5 years that we are still going through that process. And I think one of the biggest challenges we are seeing in the United States and even in some countries in Europe is clinicians who are really, in many ways, against some of the changes. And there's a whole new area with AI that you brought up where many radiologists fear the use of their future of their jobs being taken up. Do you see some of the same things here in India at all on a clinician level in terms of the use of technology and their openness to using it and changing systems, and all of that? Do you see some of that in India specifically?
We are not doing a whole lot of clinical based technology based work out of India. Most of our work is leaning in the US and in some of the areas, but I think a lot of the work around the AI for reading, for example, a radiological report is done at scale in India, as you know. So I think we are using radiologists in India. If that helps answer your
Night hawking. It's the whole concept of night hawking, as we call it.
exactly. But I think but seriously, to answer your question, I think anything that we are doing anywhere in the world in this sector catches up very fast. For example, telehealth that I was talking about, I think India just went from zero to 100 miles an hour on telehealth and telemedicine in this pandemic. So that's clearly whatever we are doing elsewhere is catching up here really quick.
Fantastic. So that actually is a good segue into my next question, which really where we're talking about a very empowered digital consumer that we're meeting today compared to the kind of consumer we talked about in the past. So if you might note, I'm using the word consumer rather than patient, simply because today we need to be looking at people on a holistic level for their health and not just as a body part or an organ.
Sure.
And I think that mindset change is being accelerated a lot by the consumers themselves, who are much more armed with information, who have access to many more things, and who are able to experiment in their lives with different lifestyle choices, etc. So as we move to the whole model of providing the right care at the right time to the right medium, which is what I talk in a very loose way of what I call precision health. As we move to that model, I mean, COVID-19 has really brought to light the whole aspect of that level of care. Because we first moved into virtual care. If I look at some numbers in terms of virtual visits, we just completed a study in Frost and Sullivan, and we tracked almost the virtual visits from 2019 was 155 million. And right now we're tracking almost 550 million virtual visits. So you can see how enormous the growth has been in terms of virtual visits. So the question that I have for you is that a lot of this is being driven by consumers themselves, seeing the availability, the convenience, the on-demand type of mentality that they want, which they're getting from other industries, but not really from healthcare. What are some of the things that this country needs to do to gear up to that change? Because is this a small section of people? The 550 million is probably a very small section of the entire population that are availing this. So, how do we scale that to a bigger area? And what are some of your thoughts from your company perspective?
Yeah, I think. I mean, I'll try and be country agnostic, and I'll give you a overall, and then we can explore, how it applies to different countries. But I think I like the way you put it. It's really about consumers, and it comes back to the age old question, whether it was in retail or financial services, of how do you put the customer in the driver's seat. And that's really what we are talking about now, right? And when I apply that to the lens of healthcare, the way I see it, and this is my personal view, is I see them in five different categories. So let me walk you through the categories, and maybe we can double click on one and talk about it. So the first category is what I call, essentially, um, self-service tools. Something that I would use to create an online appointment, to renew my or to auto renew my prescription, to electronically pay for a service, right? So that's a very simple, self-service tool, and those are available and widely used. And your 550 million number, clearly is where those tools must be being used. The second set of tools is about the wellness tools that you mentioned. These are these are tools that address wellness, not sickness, and they could be around exercising. By the way, there are some really good tools around quitting cigarettes, or taking up exercise, or controlling your diet. So there are these wellness tools, and I think that's the second category. And what we have observed is, in the COVID times, really some of those have really picked up. Especially around behavioral health, some of those have really picked up. And you know that, even companies like Amazon and Apple are now squarely in that wellness bucket. So clearly it's a popular bucket, the second bucket. The third one is what I would like to think of as transparency tools that give you more transparency. So, for example, transparency to make your own decisions. So, for example, I want to look up doctors in my area, and maybe you can give me a tool that gives me almost like an Amazon star rating for different doctors for different specialities, so I can go drill down and look. That's more transparency, right? If I want a radiology, you can look at neighboring radiologists, give me some pricing estimations for that procedure, and even give me some star ratings. And so these are things that allow me to look at it more transparently. And what for example Optum is doing is, we acquired a company called Patients Like Me, which is nothing like a social media, if you think about it, for people with, health is a long tail situation, right? You may have a disease that not many people around you have, but when you look across a large population, there could be significant people with that same issue, and you can chat amongst yourself, what worked, what didn't work, what process. It makes you more knowledgeable as a consumer. Again, not patient, but as a consumer. So that's the third category, the transparency tools. The fourth one I would call, the virtual access tools, which is electronic visits, but also more than visits, monitoring of care, etc., for older people in their house and so on. And Vivify Health that I mentioned earlier, we offer solutions in that space. And finally, what I would call the larger, all of these four things need to come together in one form, seamless form for it to work. And that's the electronic, what I would call the distributed distribution tools and so on. And at Optum, we acquired a platform called Rally, which we are using as our base platform for in-depth digitalization, and that's what we are using. But very clearly, uh, you know that's where the future is. Whether it is around self-service tools, or wellness tools, or transparency tools, I think that's where the user wants to go. And a good example would be, I don't know if you have used it, but now I've been in India for quite a few years now, and Arogya Setu, for example, it was a great example of a tool that you could download, and it would take up a complex task like contract tracing, and do a pretty good job of it in your app. So these are some examples that I would say, and that puts customers or consumers in the center, and gives you tools to go deeper into your healthcare journey. I'll pause and see if that resonates with you, and if you have some thoughts on it.
No, I love the whole product, Patients Like Me. I was following that for a while and covering it, and it's a fabulous product. And I myself have used it because if you have rare diseases and you build virtual communities, and in a lot of ways you become more knowledgeable than the doctor because you're spending so much more time in that virtual community than a doctor who's treating patients all across the scale. So then you are able to give a better diagnosis of yourself than a clinician can do. So I think these are really good armors that I see that consumers can get to take better control of their health. And really, we are moving to an age of the empowered consumer, in a sense. And I think because of that, the systems also have to change in a lot of ways because we're, as you said earlier in your discussion of moving care outside the hospital, I mean, that is a huge movement right now in the United States. And one of the big things that we've learned from COVID is we're trying to build hospitals at home. So if you get to an emergency room, you are often sent back home and you have an entire care team that is taking care of you through remote monitoring services and other wearables, which are medical grade that you can be taken care of. And rather than be in an ICU in a hospital, you're actually being monitored at home. And CMS has just given a reimbursement for that to bring in Women's Hospital in Boston and other places. So it's a tremendous watershed time for us to be actually building some of these facilities, and especially with such an older population that India faces as well, with such high chronic disease. I think these are good areas for investment in the future.
Sure. And it's amazing how quickly the regulatory framework has moved to accommodate some of these things that we are talking about. A year ago, maybe not so much, but now all of a sudden through the pandemic, a lot of things that we thought would take time has accelerated, and we are there. So
Yeah.
I hope we continue the momentum into 2021 and beyond. To
I
your
think I think one of the biggest things that I have seen happen is that we put at least mental health on the table.
Yeah.
This was such a big issue. Mental health and social determinants of health. These are the two big things that were always behind the scenes. It was in closed doors, and right now, with a 30% increase in mental health globally across the world, it's definitely become part of the agenda that people are beginning to talk about and start looking at what tools and services we can give to people at home to be able to get resources to make calls or SMS or chat. In case you're having issues with depression or loneliness or fear or what anxiety. So I think we're entering into a very good time. Go ahead. Sorry.
No, I was saying that's a very good point, actually. That's a key area of focus and investment for us as well in 2021 and beyond to say, you know, how do we deal with such issues? And technology, as you rightly mentioned, can be a great accelerator, especially in behavioral health kind of situations where, a lot can be done with technology.
Absolutely. So I just see that we have about 3 minutes left, and I want to end with a subject which is very, very close to my heart. As you probably know, I'm doing a lot of work with women and leadership and STEM, since there's so few of us out there. And I was so excited when I was researching your firm to see that you're one of the best workplaces for women. You have some amazing programs for women at your organization. Can you share some of your best practices, what you're doing? Because it would be great to take that to the world.
Well, I think to my mind, this is a 30-minute topic, and you said we have 3 minutes, so I don't know what to do with it. But here is the short answer I'll give you. Not only is it important to celebrate the diverse workforce, which we do at Optum, but here is how I think about it. If we are going to take on some of the world's hardest and most important problem, but we want to only focus on a very small subset of the talent available to do that, it's going to fail. I mean, that's not how you do it. So just very simply put, if you look at it logically, we need every single it's not about it's about availability of talent, regardless of any other dimension we need, because these problems, as you know, are hard. It's taken generations to solve. But some simple things. I think training is important but overrated. We've done that. Everybody's done that. I do think we need stronger networks. We've invested in a technology women in United Women Leading in Technology network, which is really helping people at across the levels of seniority, from all the way very senior to absolutely newcomers, that network is very important. And we do it in India in a network called WIT, which is a India-wide network, and we invest in that, and we leverage from that. And policies. I know we're out of time, but your policies need to be geared towards the thought of different people working under different circumstances. And I think COVID has given us the ability to say, hey, you want to work part-time, you want to work flexible hours, you want to work from home. That's clearly possible because we are doing it at 100%. So I'm hoping that we are able to tap into every single individual that wants to contribute to solving these hard problems. And more than our companies like us should invest in ways to make it easier for a much more diverse population to come in and do it for us. I think it's a matter of economic survival for us to embrace some of those things, and no longer just a good thing to have.
Yeah, no, I think that's fantastic.
So
I know,
I
Ravi,
have
you're wanting to jump
yes,
in.
yes. I have a lot of questions coming up on the Q&A because it's a very interesting session. But I've chosen a couple of questions for the paucity of time, which are very interesting questions. Probably this one is for you, Ritesh. There are majority of low, mid, and high income group consumers in India willing to invest and pay for private health insurance? That's the question. So how do you see that? And also there is a missing middle for a phenomena which government is trying to address, because we have the population below a certain economic level are provided under the Aishman Bharat, and then industries and people who are working in the mainstream industries or the government organizations, they have their insurance from their companies. But if you're looking at the missing middle, most of them will have to go into the private, health insurance, which is a significantly low percentage. So how do you see that shaping up in future?
Yeah, again, let me get started, and I want Dr. Das to also speak up. But to be honest, to be fair, I'm not an expert on the Indian, situation. I don't want to, pretend to have too much knowledge of it. But one statistic stands out, and maybe you can look it up. Is what is the percentage of GDP that we spend on health? And I think on that metric alone, and India is a straggler. So I think there has to be, as you said, there are many policies available, ways available. We need to extend some more ways of jointly funding, some of those insurance policies or something. It cannot be done by the private person alone. You have to meet them halfway. In absence of a Medicare-like policy, you have to meet them halfway at least. That's my thought, but I'm no expert in the Indian system, so I can't really answer with any.
Fair enough. Yeah, yeah, I got you. I think there are a lot many players who are trying to fill the gap, and then I think institutional, organizational programs are being devised to bring in, especially
Exactly.
the small groups of companies where 10-member company, 5-member company. So how do we actually aggregate? There's some new models are evolving. I think hopefully it'll
Correct.
come to mind for. The next interesting question I have, I think Dr. Reenita, you may be able to, because you have seen the world. What are the key differences between healthcare at doorstep between India and or compared to in India and the West, or maybe any other marketplace with the geographically big, large population, the healthcare at doorstep, how it is challenging compared to uh, advanced countries where the population could be more or less. So, what are your insights onto that?
So you said healthcare doorstep.
Healthcare at doorstep, yeah. How is it evolving? Is it really?
You're talking about the digital front door. Is that what it
This,
is?
yeah, I agree. Yeah.
Okay. So I think it's evolving all across the world. And in our predictions, I did predictions last week for 2021. And one of the predictions that we made was that 35% of interactions will be virtual as we move forward. And the physician will no longer be the point of contact for every engagement that a patient has. There would be different people be emerging. So I do believe that COVID has been one of the uh, aspects that has completely shattered the glass ceiling in terms of creating the digital front door. But what we now need to really work on is patient engagement. Because what it is that we can have all the technology in the world, but if we don't make it simple, easy, personalized to meet my needs, then I'm not going to use it. And we know with apps and technologies like fitness trackers and weight loss, you do it for 3 months very rigorously, and then you drop off the curve and you never get back. So what we have to do is create systems whereby there's constant engagement happening, and it's two-way engagement. It is personalized, and there's ways that we can continue to engage the consumer in different areas on a holistic level. Because really, so far in healthcare, we've really been treating the consumer as someone who doesn't understand anything, they don't know anything, and so we just give them stuff, and it's a reactive way of dealing with them. And we have to change that. We have to build a relationship. And I think it is upon the healthcare community to start building relationships with their customers. And their customers are the patients, the consumers. And I think this is one thing as a world, as a globe, we've come to realize because of COVID. We have to build relationships with customers.
Thank you.
Just to add a quick point to it, I don't know how much time we have, but just a half a second point to it. In the US, if you look at, there are optional surgeries like LASIK, the eye surgery. If you look at the optional surgery cost line, it goes like that. The costs are falling rapidly, the quality is going up, whereas for non-optional surgeries, the cost is going up and the quality is staying flat. Why is that? Because in the non-optional surgeries, the customer plays a very strong role. The consumer is very interested. He's investigating where to go for LASIK, why, and he's taking a very active role, and that's actually impacting the outcome in a very strong way. So my strong view is that the customer, I agree with Dr. Das, that if you can engage the customer, you'll have all the right outcomes that you're not having right now.
Thank you, Dr. Reenita and Mr. Ritesh, for telling us and enlightening us on the healthcare transformation through technology. We would like to have more and more such dialogue with you.